Hello friends, today we are going to discuss about COVID grief. I am Dr. Suresh Padadmat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic and training purpose only. If you want to have a clinical opinion, please do contact any mental health professional. Conflict of interest? None. Grief. Grief is the emotional, cognitive, functional, and behavioral reactions of any person who might have experienced a result of loss. So, this grief is a normal response to any loss. It may be job loss, financial loss, a relationship loss, or else dreams falling apart, or else because of health, that maybe a person has been diagnosed as cancer, maybe COVID, or else loss of a life. Grief is universal. The experience of grief are among the life's most stressful events. Each person's grief is unique, complex, and very personal to each individual. Everyone deals with it differently. Usually, people recover by 2 to 3 weeks. And depending upon the culture, religion, personality, gender, and other factors play a very important role, the person, the way they grieve, and also they express their grief. At the same time, you should remember, every human have a tendency to find a meaning because of this grief or a trauma. And they would like to know what is the reason for this loss. Is it internal or external? Why me? Why it happened to us? What we did wrong? What is the reason? And the main reason being is to make a sense of this situation and also to know the closure about the event and sometimes to know the reason why it has happened. But however, the grief being a normal response to any loss, but however, if the grief is because of a trauma, it becomes complicated. For example, this grief being unexpected, sudden, life-threatening, violent, unnatural death. In such a scenario, there is a trauma and plus grief. For example, road traffic accident leading to death of an individual. The family will have a traumatic grief. Rape and murder. Here also, traumatic grief will be there. Along with the grief, they have to make the sense out of it, why it happened to them. And the human being wants to have control over the situation or else about their own life. Hence, they try to find answer to this grief. So let's understand how trauma and grief interacts. This is a grief that is response to a normal loss. Every person on this earth will have loss. It may be in different form. So that is grief. But however, the grief is resultant because of a traumatic event. Then there is a trauma-related grief also. That is traumatic grief. So here today we are going to discuss only about the grief. I'll be making a different video on traumatic grief because traumatic grief is a different way of dealing. The therapy is different. Today in this, I'm going to discuss only grief. So let's understand grief. The first and the foremost, a Swiss-American psychiatrist named Elizabeth Kübler-Ross discussed about the various stages of grief in her book called as Death and Dying, which was released in 1969. And the grieving or the grief, the process is called as grieving. This grief can be of two people can experience. One is the primary victim who goes through this death or else loss. The secondary victim is basically the family, friends, and the society. So each one of them have to deal with this grief. The primary victim, if there is a traumatic loss, then the primary victim survives and he will go through the grief. The secondary victims become very essential if there is a death of primary victim. So then the secondary victim has to face the loss because the primary victim is no more. Now let's understand how the different stages of grief goes through. And for both primary and the secondary victims, the grief is same. Though the primary person we can call it as a victim, but the secondary we can call it as a survivors. Let's go through the each stages of grief. First stage is shock and denial, anger, bargain, depression, and acceptance. So these are the 5 important steps Kübler-Ross had given. As soon as a person receives a loss, a death of a loved one, there will be shock and denial first. How can it happen to me? No, it's not possible. Yesterday only I saw them. This shock and denial is the first response. Immediately there will be an anger. Anger to the external environment or else to the internal. External means, how did they do to them? How can the God be so merciless to the loved one? Or else, did I do something wrong? I should have gone with them. So the anger may be turned inwards also, or maybe outwards. The next comes is bargaining. The fourth one is depression and acceptance. Let's discuss each one of this stage separately for individual, who is a primary victim, and the secondary survivors, that is the family members. So let's discuss with shock and denial. The Kübler-Ross talked about this stages. See, in the x-axis, we can see the duration is mentioned in weeks, and in the y-axis, it is emotions. So invariably, whenever there is a news or the information comes about the loss, first and the foremost is shock. There will be a numbness. They don't know what to do. The reaction will be just like derealization phenomena. They are detached. And as soon as that, there will be a denial. It can't happen. It can't happen to us, to me. So the denial will be there. As soon as that, the anger starts in. Anger towards the world or towards the self. And then there is a bargain. I'll talk about this bargain shortly. And then starts the depression and finally the acceptance. So these are the 5 stages how the emotions move around. And invariably, every person recovers within 2 to 3 weeks. That is the reason immediately after the death, in our culture, like in India, the rituals are carried out after 2 weeks. So the ceremonies are conducted. So this is how the Kübler-Ross has given the 5 stages of grief. But at the same time, please do remember, these 5 stages have been divided into stage 1, stage 2, and stage 3. So these are the important stages, but however, we will go through the 5 stages. But again, please do remember, in a simple, straightforward grief, it will go through these stages. But if it is associated with trauma, guilt, depression, substance use, these stages can be mixed up. That means a person may start immediately going to depression immediately after receiving the information, and he may even attempt suicide. So the depression may be the presenting symptom. So, or else a person may not show any symptoms. The numbness may for long duration of period. So the stages gets mixed up depending upon the person. First and the foremost, shock and denial. Let's understand about the individual. The first thinking process, as soon as the information is received, how can it happen to me? It can't happen to me. This can't be possible. No, I will not believe this. This is how the person thinks. And the behavior will be delay in seeking help. They avoid testing, especially in COVID, refusing to go to the hospital. They will become uncooperative. This is seen very classically in COVID. As soon as the person has fever, they refuse to take testing. They refuse for treatment. They are afraid. How can it happen to me? I was at home. Who transmitted the disease? So these are the questions they start feeling. And the shock and denial may have an important role in help seeking. With regard to family, how it can happen to us, to me, what would we do wrong? The same cognitions will play a role. Sometimes the behavior of the family members, they may abandon the family members who are positive. Like children may abandon their elderly family members are geriatric, or else they may avoid detections. That means they do not test at all. So shock and denial is very, very essential component which leads delay in seeking help. The second stage is anger. In individual, the first and the foremost cognition is no one cares us. How they transmitted disease to me? The system has collapsed. I can die. The whole society is responsible. This China may be the responsible for this coronavirus, or else this society is doing this, or else they may become angry even to the government for not doing lockdown immediately. Similarly, these kinds of anger may be either towards the self or towards the society or towards the government. It can be to anybody else. Behavior will be abusing the infector, abusing the community, abusing the leaders, posting badly on social media, shouting at people. This can happen. Similarly with the family members, how can my dad can get this infection? I told him to wear mask. He was irresponsible. He did not listen to me. So these kinds of things starts becoming angry with the family member who is got infected. At the same time, the people may become angry towards the healthcare personnel, ransacking the hospital, abusing the government is very common. This happens when there is a shock and denial. They take the patient delayed. By the time they reach the hospital, the patient is almost gasping, or else he may be in the oxygen saturation of 70. Once he goes into the ICU, invariably the death is inevitable sometimes. Once they hear this, family becomes angry towards the healthcare personnel, or else towards the doctors, nurses, hospital. So this anger is one of the way of venting out which is commonly seen in any of this kind of grief. But at the same time, you also should need to know about daughter from California syndrome. This is a person who is not taking care of their parents, or else maybe grandparents, and they have not seen for a long time. As soon as they come to know their family member is ill and is admitted to the hospital, and they realize that they have not taken care of them, they have their own guilt, and suddenly they end up in front of the hospital. They start abusing the doctors for asking for a good, excellent treatment. They want the hospital to provide the best possible medications and to save them. This is basically to compensate their guilt. Unfortunately, many a time, these elderly population or the people may die. During this time, these daughters from California syndrome, they become highly violent. They start shouting at the healthcare personnel, and sometimes they become litigious. So this is one of the commonest which has been seen in the Western country. Nowadays, we are seeing even in India. The third stage is bargain. This is in bargain. The cognition will be the individual usually starts thinking in his own mind, and he starts with bargaining with the nature, or it may be with the Almighty God, or else they may bargain themselves. Please save me. I have developed cancer. If you save me, I will stop smoking. I will offer material to the God. I will do something good to the society. So this bargain starts. Or else even he may say, please give me 1 more month to be alive. I would like to do my daughter's marriage. So that is bargain. The behaviors will be sometimes confused, turmoil, irritable, and many a time they start crying, they will be laughing, and they will make some kind of joke which is very difficult to comprehend by the family. So that is bargain. The family members also may start thinking we will offer money to the temple, church or masjid, and they may also say, if you give 1 more month, we would like to spend time with my son or my daughter. So this family bargaining is very well common, seen in the society where there is a guilt towards not taking care or not providing care. At the same time, how can it happen to my family members? So these kinds of bargaining is very common. And they start dealing with the religious rituals and various things. So this again may come in the way of medical treatment, telling that Please allow us to go to the temple or church for the pray. So this is again it's a part of the bargaining process in the grief. Coming to the depression, that is the fourth stage. This is where the hopelessness sets in. Nobody can help us. Worthlessness, we are not good for anything. Helplessness, no doctor can help us. Sometimes you can see the behavior of anhedonia, crying, suicidal ideas, withdrawn, being tired. Many a time, family members may also get this depression. Sometimes they may say, if dad has died, the son may say, I also need to go and join my dad. Sometimes they start using drugs, substance, alcohol. Family members sometimes even do suicidal attempt. So these are the symptoms of depression we have seen. Many a time in COVID wards, the people suddenly go into depression because they have been diagnosed of COVID and they feel that there is no hope and they commit suicide. That is, death by suicide is common. Acceptance. So this is a phenomena which takes time, sometimes 2 weeks, sometimes maybe 4 weeks, depending upon the grief and the person's coping skills. Acceptance will be, okay, this is no more, I'm fine, I'm okay, let's move on. So that they have accepted the situation, they move on. Once, if there may be a recovery from the illness, or else they accept the illness. Behavior will be resilience and normalcy. The family members thank God, or else they know the person has died. They learn to live without that person. Although the person who was demised, still they are there in their hearts. They carry that memories with the joy rather than with the sorrow. And they are able to lead the normal life. That means they will go back to the routine. They will start functioning. They will be able to deal with their emotions successfully. Coming to the complicated grief. Till now, we talked about the grief which is normal. The complicated grief are those. This is the normal way of dealing the grief, which occurs like shock, denial, anger, depression, and also the acceptance. There may be sometimes exploding grief. The person becomes extremely violent, or else he may attempt suicide as soon as he comes to know that he has been diagnosed as COVID and there is an ambulance waiting outside the house. He feels that how can I leave my family members? He may jump off from the building and he may commit suicide. That is exploding grief. There may be no grief at all, completely absent, no emotional response. Delayed grief. That means the grief will occur after 2 or 3 months down the line. We are expecting to have this delayed grief in many of our general population because they are not able to grieve during this COVID. They have seen their family members going to the hospital, they have never returned back. They have not completed the rituals of cremation, rituals of grieving has not occurred. So that may cause delayed grief over a period of time. At the same time, we may also see protracted grief. That means grief lasting for many years, maybe 2 years, 3 years. And at the same time, you can also see the grief may be oscillating. This is usually common in depression or else in personality disorders. With substance use, you can see this oscillating grief. So all these complicated grief requires professional help. Without that, they may able to lead their life, but they will not be functional. They will have erratic behavior. They have emotional problems. They will become highly sometimes abusive. Substance use increases. Hence, the impact of complicated grief usually requires the professional help. And the complicated grief many a time requires therapy for long duration. If this complicated grief is associated with any traumatic event like non-availability of bed, non-availability of oxygen, and before they reach the hospital the person dies, or else even in the hospital when they are seeing their loved one dying, then sometimes they may become angry with the society because the government did not take care of them. And that complicated grief can last longer. And these are the people we require to support them. At the same time, they need to seek help. The impact of grief. First and the foremost is denial of illness, denial of death, denial of having problem, refuse to undergo any testing or treatment with regard to COVID, non-cooperation for treatment, avoiding isolation. They are scared about dying alone. They become extremely shocked or denial. Sometimes they may have panic attacks, anxiety symptoms, recollection of thoughts, images of the loved ones, suicidal attempt, death by suicide. Protracted emotional turmoil is very common, especially with the impact of grief. Let's now discuss about the management of grief. The first one I'll be discussing about, there is a grief which there is a loss, not death. So this is a loss. Society should stop stigmatizing the circumstances related to COVID patient and enable them to cope with the loss. That means whenever there is a death, the family and friends should stop asking, was it a COVID death? Did he take vaccine? Oh my God. So those kind of reactions should be stopped. Do not stigmatize. If you stigmatize, what is happening is in the society is many family members do not want to seek help, do not want to go to hospital. They will wait until the oxygen saturation falls down to 60. The patient who is suffering also do not want to go to the hospital. They are afraid, they are scared because the society is going to stigmatize them, they are going to discriminate them. Even the family members are scared to go to the hospital. This is again, everything revolves around stigma and discrimination. And this again leads to false number. And many a time the person who dies because of COVID, the family members refuse to even test them. They want to hide. And they want, because of stigma and discrimination. And this what happens is, we have seen many family members saying, please don't make a note that they are COVID deaths. Because if it is a COVID death, the protocol has to be followed. The authorities will come and take the body. And there will be a waiting period for cremation. Only 5 or 10 people are allowed for the cremation. At the same time, the society, what they will say. At the same time, the sense of guilt. I did not take my family member to the hospital in the right time. I was a failure. I could not get even a bed to my dad. So this kind of grief is a big problem, and that needs to be decreased only by decreasing stigma and discrimination. If we don't do that, this will continue. At the same time, a family member can also be made to stay with the patient in the hospital, especially in the COVID ward, high dependency unit. This has two important roles to play. First and the foremost, the person who is suffering from COVID feels comfortable that there is a family member with them. Otherwise, many family members, especially elderly, they say, anyhow, I have lived my life, let me die in the house. They refuse to cooperate to go to the hospital until they are gasping. So, having a family member, they will feel comfortable. Not only that, the family member who accompanies the person who is suffering COVID may also be already been infected. He feels, I have done my duty towards my dad. The guilt will be less. And being in the hospital, he may help the patient in providing food, taking care of them. And if the person dies also, he knows, yes, the suffering is everywhere. And he is able to have solace that I did my best to my dad or my mother. So this again depends upon the hospital policy. And India being a country where the family members care each other. And whenever they are ill, they get together. And this COVID has divided it. Unfortunately, whenever there is a COVID positive, we isolate them. We keep them in a COVID care center. We keep them in a high dependency unit. No family members are available. And many a time, CCTVs are not there. So the loved ones are waiting outside with frustration. And when they don't hear, and when they come to know the person has passed away one day back or 24 hours back, they become extremely angry. That means instead of shock denial, they jumped into anger. That is the second stage of the grief. And this is a common response, and this can be avoided only if we are able to allow the family member to stay with the patient in the COVID center. I know, being a doctor, I should not advocate, but our society, this is the way. You go to any government hospital, any district hospitals, or any other hospitals, apart from corporate hospitals, invariably, a family member wants to stay with the patient. And the security guards will be finding it very difficult to stop them. And many fights with the family members and the staff in the security guards is very common. This can be avoided here. But however, supplying food, providing care to the family member if he becomes infected, these are the challenges. But the society wants transparency, and the grief can be reduced here. So hence, this is my personal opinion. Whether a family member can be allowed to stay with the COVID positive patient can be considered. Especially in child or in children, we allow the family member to stay with them. So similarly here, we can consider this. And this is just my personal opinion. And also, there should be an ongoing communication between the patient and the family members. So the internet availability, using our smartphones should be allowed. Keeping the communication open between the treating team and the family members is also highly essential. Although this is commonly seen in a family which are very closely knit and cohesive, there are families we have seen where the family members have ran away when they came to know their parents are COVID positive, and they even refuse to cremate the body. This is the saddest thing we can see. So this is again a part of grief, that is absent grief, denial, shock. So they do not come even do the grieving. They don't even grieve also because they are in the shock and denial. Technology-driven communication should be enabled so that the patient and family members are in constant touch when they are in the COVID center. Now there comes the very, very taboo point, that is discussing about death because of COVID. This is a very sensitive issue, but however, we need to prepare ourselves to provide care for the people who are grieving. So earlier in the society, the death used to unite us. We used to go together, grieve together, but in COVID, that is not possible. The authorities have made clear-cut rule, not more than 10 people, and depending upon the state, it may be 20 or 30. So that means the death is not uniting us. The family is alone. They are unable to grieve. After 2 weeks, usually we used to have ritual. That is also not possible. The family members are not able to travel and do certain rituals. So this has created more problem because the people, once there is a death in the family, the grieving ritual is very essential for healing. Rituals by the loved ones to be encouraged. Allowing them to talk about the loss. The person who have died, they need to be encouraged and talked, and if possible, various methodology should be adopted so that they discuss and their cognitive process. I did not do to my loved one, or I did not take care of my dad, and the last moment I was not there with my dad. So these kinds of guilt, which the anger turned inwards, is very dangerous to that person. That is, can be limited by asking them to talk to them and validate their emotion. Yes, if I am in your place also, I could have not done much. So those kinds of healing process is required. And please do remember, everyone will grieve in their own way. Allow them to grieve in their own way. They may do not cry. Sometimes they may become exploding grief will be there. And the normal grief, especially because of the death, 90% will recover on their own if the family and the relatives support them. Only 10% requires professional help. And those 10% invariably will be complicated grief or traumatic grief. Allowing ventilation. If you are a professional or a family members, you have to just listen to them. Listen to the family members who are grieving. Do not speak. Do not say, okay, just forget it. That's not impossible. If a person whom you love dies, the love for that person will never die. The only thing is you will learn to handle those emotions. Here, the more they express, the burden of the emotion decreases. At the same time, you have to validate their emotions. Yes, of course, in the last moment, you were not able to get oxygen to your family member or dad or mom, and he passed away. Any person, even I am in your place, I would have not been able to get the oxygen because the demand was so much. The suffering was so much. The number of cases were too many. And nobody expected this. And anywhere in the world, such a disaster or a pandemic is difficult to prepare, difficult to plan, because the number of cases were simply impossible to handle. So that if you are able to provide that validation of emotion so that the guilt can be decreased and start giving new meaning to their life. At the same time, you can also sometimes, a person says that I was far away from my dad and he died and I was not there in the last moment. Now you can say, you bring in an open chair technique. You can tell the person, think that your dad is sitting next to you or in a chair. Talk to him. express, say sorry to him. And sometimes they may grieve and they may cry also. So allow them to express their emotion. Don't tell them stop to cry. Let them cry. Ask them to bring photo albums so that they discuss about what was that emotion, what was the picture captured there. So that gives moment of connectedness. And also, many a time, people may not be able to express their emotions. Ask them to write a letter to the person who has died. Ask them to write and then think that they have posted it. So, in many a time, you can also ask them on behalf of Father, they can only write and said that they have given forgiveness. So, you can also use art of expressing feelings. That means maybe drawing, maybe dance. So, various ways of people have learned their way of coping. And that needs to be encouraged so that the grieving process completes and the healing starts. And at the same time, many people may find it very difficult to have a sense of closure. That time you can say that do something in the deceased honor. Imagine Mr. X has passed away. He used to like dogs or pets. Now this person can start doing something to the pets or the pet animal so that the person feels that he has been honored. If a person used to love the orphanage homes or he is a teacher who passed away, now this person can donate money to the schools. So giving a meaning for the life is very essential. At the same time, many persons with the traumatic grief may have a complicated and they may think that I'll be all right in 1 week or 2 weeks. Having a realistic goal is very essential. The person who is grieving need to be patient so that sometimes time may be the healer. And one important thing we have to tell the family members, learn to forgive yourself. The life is, we live for n number of years. The last moment is not the one which decides what you are. You would have loved your father, mother or brother or sister for 60 years. On one fine day for 15 days, he went for the hospital, he did not turn back. That 15 days is not going to define the relationship between you and him. That is the ending. But the whole 99% of the life is you have shared with them. Don't carry the burden of that last 1%. That has to be communicated to them. At the same time, not only forgiving themselves, you also should anticipate anniversary reaction. It may be on their birthday or maybe the same day the person expired or deceased 1 year down the line. And if this is not going to help them, or else if they are using drugs, substance use, or they are attempting suicide, please seek professional help. Professional mental health should be sought because this requires therapy. And the only answer for grief is grieving. That means the only cure for grief is to grieve. Thank you very much for giving your valuable time. Stay safe.